Good day, our viewers at home. Welcome back to our channel. Today we'll be talking about hepatitis B and pregnancy. Just as we know already, July 28th has been separated by the World Health Organization to create awareness for hepatitis. And as an organization, we've been taking us through a series of topics on hepatitis, different types of hepatitis, the treatment models, and the likes. You can see our previous video and look out for coming video as well to get more enlightened. But today we'll be focusing on hepatitis B and pregnancy, and we'll be talking about the risk to the fetus, the antiviral use during pregnancy, and newborn vaccination protocol. First of all, I'll be introducing hepatitis B. And hepatitis B is a major global health issue, especially in pregnant women. There are different ways through which it is being transmitted, but for pregnant women, one of the main factors is called vertical transmission, which is a key driver of chronic hepatitis B virus in children. And prevention during pregnancy and after birth is very crucial for children. And I'll be talking about how exactly it being transmitted when during pregnancy. First of all, I will be talking about intrauterine, which is a very rare occasion. But intrauterine means during pregnancy while the baby is still in the womb, according to the layman language. While the baby is still in the womb, it is very rare. But the most common cause of the most common means through which it is being transmitted is during labor, peripartum, during delivery, the process and the period around delivery. And the last part through which it can be transmitted is postpartum, which is close contact after the delivery, the period after the delivery between the 0 days to 28 days after delivery, postpartum. It's 6 weeks after delivery is called postpartum. And this period is very crucial as well, and the baby is exposed more to getting this virus during this period. And the mother that is positive to hepatitis B E antigen is more at risk of transmitting the virus to the baby. They carry more risk because of the presence of the hepatitis B E antigen shows that it is very deadly, and they might easily is highly the virulence level is high, and they can easily transfer it. And the risk to the fetus without intervention for a mother that is hepatitis E antigen positive is 70 to 90%. And you know, that is a very high rate, high chance that should not be taken at all. And I want to say chronic hepatitis B virus is in 90% of infected newborn due to whichever way they might have gotten it through their mother. Is one of those things that we do see in our present world. And once a child is exposed and is having chronic hepatitis B, there is possibility that they can develop some long-term risk or long-term complication, which include liver cirrhosis, liver cancer. And I know no mother or parents want that for their children. So we'll be talking about the screening that ought to happen during pregnancy. First of all, there is universal screening. Either you are known to have hepatitis B or not, every pregnant woman should be screened for hepatitis B, hepatitis C. They are the most common screening ones. Blood screening that should be done for every pregnant woman. Once there is positive hepatitis B antigen from the results that was taken, there will be need for additional tests, and the additional tests may include hepatitis E antigen, hepatitis B virus DNA. This is to confirm the viral load, and liver enzyme tests, which include the ALT and the AST. Those both of them are liver enzymes. So all this will be screened to know the state of the mother and to know what kind of treatment will be required for the mother to have. And by the time the hepatitis B virus DNA is checked and the result is greater than 200,000 international units per milliliter, that mother is indicated for treatment during pregnancy. So the mother will be given some antiviral therapy, which include tenofovir disoproxil fumarate, and the treatment is usually started around 28 to 32 weeks of gestation. I mean, that is 28 to 32 weeks of pregnancy, and mostly stopped at between the 4 to 12 weeks after delivery, unless the mother really needs it to control her viral load. And this is as well, there is a kind of safety in the drug that I have mentioned earlier, the TDF, which I have mentioned, uh, uh, the disoproxil fumarate that I mentioned earlier, is category B, and it has no teratogenicity effect. So it is very safe in pregnancy. There is no cause for alarm. It is safe for fetal kidney and bone health. So there is no need to be worried that what won't it affect my baby or not. No, you are very safe. It is very safe to be taken during pregnancy, and breastfeeding is allowed if newborn prophylaxis is done. Yes, despite taking this does not mean the mother should not breastfeed their child. No, there are still some things that will be taken, but we'll mention that later in this presentation. So now we talk about the newborn vaccination and the prophylaxis. The common one is within 12 hours of birth, hepatitis B vaccine, first dose must be given. The hepatitis B immunoglobulin must be given as well in different sites of injection. That is within 12 hours. Some say within first 24 hours. However, this is according to some journals and the Center for Disease Control, the US Center for Disease Control. They believe every pregnant woman that is screened for hepatitis B, that is positive for hepatitis B surface antigen, should their child must have hepatitis B immunoglobulin within the first 24 hours, together with the hepatitis B vaccine, which makes it safe for all children born to hepatitis B mother. However, in the UK, there is a different protocol. They screen a mother that is having hepatitis E antigen negative, and the baby's birth weight is above 2 kg. They may necessarily not be given the hepatitis B immunoglobulin injection either at birth or later. They will do further screening, which will be mentioned. They will do further screening, further follow up to be sure that the baby still remains safe and within the range, but it is not given to every child. According to, is a slight difference between what's different from what the CDC recommends. As we can see here, this is from www.ukgov.uk, and it's a publication from the UK government. Is a bit different from that of the Center for Disease Control in the US. While Center for Disease Control in the US make a kind of general statement that every child born to hepatitis B virus mother must be hepatitis B virus positive mother must be vaccinated and given hepatitis B immunoglobulin within the first 12 to 24 hours. UK have some indication, which is majorly for their own criteria, and you can see here the one of the criteria for the child to be qualified for hepatitis B immunoglobulin is the mother that is persistently infected with hepatitis B surface antigen, where hepatitis B E antigen is detectable or its antibody is not. It means the mother is HBV positive and the hepatitis B E antigen was tested and the mother is positive to it, or the antibody of hepatitis B antigen is not detected, the child must have it. Hepatitis B antigen positive and known to have hepatitis B virus DNA level equal to or above 1 times 10 raised to power 6 international units per milliliter. This is the same thing as the viral load greater than 200,000 international units per milliliter that I mentioned earlier. Hepatitis B antigen positive as a result of recent acute infection. Hepatitis B antigen positive and the baby's birth weight is 1.5 kg, that is 1,500 gram or less, regardless of the E antigen status or the viral load of the mother. So we can see if a mother or the child does not fall into any of this category, in the UK, you may not be recommended to have your child may not be recommended to have hepatitis immunoglobulin injection at birth. But all the normal checks up, all the normal hepatitis B vaccine will still be given to the child, and they will ensure they follow through the treatment protocol. But in the US, it's a bit different. For US, these are the criteria for them. They have different and two types. There is a single antigen vaccine and there is a combined vaccine. For them, the birth weight, even if the birth weight is greater than 2 kg and the mother is positive to hepatitis B surface antigen, the child must have either of these, either less or equal to 12 hours, have the first dose of hepatitis B vaccine, and then must have hepatitis B immunoglobulin in less than 12 hours also. Same with the combined dose, for the combination dose, either of them. And then must have the second dose of the hepatitis B vaccine in 1 to 2 months after, and the third dose at 6 months. With the combined one, must have the second dose of the hepatitis B vaccine in 2 months, the third dose in 4 months, and the fourth dose in 6 months. And in situation whereby the hepatitis status of the mother is unknown, the child must have the vaccine, the single vaccine at birth, at 1 to 2 months and 6 months, and the combined dose follow through as well. When the mother is negative, the child only have the hepatitis B vaccine with 1 month, 2 and then at 6 to 18 months. When the mother is positive and the child is less than 2 kg, the child must have hepatitis B vaccine on less than in 12 hours, within 12 hours of birth, immunoglobulin within 12 hours of birth, and then in 1 month's time have the second dose of hepatitis B vaccine, have the third dose of hepatitis B vaccine in 2 to 3 months, and have another fourth dose in 6 months. That is for a child less than 2 kg. And if the status is unknown for a child less than 2 kg, the protocol still remains according to the Center for Disease Control, that the child must have the hepatitis B vaccine at birth in less than 12 hours, have the hepatitis B immunoglobulin, have another dose at 1 month, have the third dose at 2 to 3 months, and fourth dose at 6 months. This is their latest publication in this current year, 2025. And if the mother is negative and the child is less than 2 kg, the child must have hepatitis B vaccination at hospital discharge or within the first month, and second dose in the second month, and the third dose between 6 to 18 months. You will see here this publication was done. This was published in January 31st, 2025. So this is their latest publication from the CDC, Center for Disease Control. Okay, so let's move on. And despite the recommendation of the Center for Disease Control, hepatitis B vaccine first dose given within 12 hours and immunoglobulin given within 12 hours or 24 hours, or whichever way, there are follow-up that needed to be done. The second dose of the hepatitis B vaccine will be gotten 1 month after. Note, it is just the second dose of the hepatitis B vaccine that is being given again at 1 month, not hepatitis B immunoglobulin. The hepatitis B immunoglobulin is only given at birth, and the third dose will be given at 6 months, and there will be some serologic testing that will be done at 9 months and 12, between 9 months and 12 months, so as to know if the child have developed immunity or enough, and if there is a need for any further testing or treatment to be given. And the vaccine, from different researches, the vaccine, hepatitis B vaccine given with hepatitis B immunoglobulin reduce the transmission of hepatitis B from mother to child to less than 5%. You can see how significant that is. We initially, from this presentation, we mentioned to you that the mother that have a high viral load carries 70 to 90% chances of transmitting it to their child. And this vaccine, after delivery, can reduce the transmission to less than 5%. So you can see that is a very drastic one. And failure usually occur in high viral load cases without maternal antiviral. You remember we said when the viral load is very high during pregnancy, there is a treatment that is given to the mother, the TDF that was mentioned earlier. So this may not work appropriately, like the vaccine and the hepatitis B immunoglobulin may not work appropriately, may not reduce the risk of transmission to less than 5% if the viral load was high during pregnancy and the mother didn't get the treatment. That is, in most cases, those are the situations where the failure rates occur. And there are some that are not even screened. Maybe those born in some very thick rural setting where there is no accessibility to screening, some blood screening, and they just leave everything to fate. Some that, and they don't even know that they are infected, or they probably are chronic carrier of hepatitis B. They have high tendency of transmitting it even if they get this vaccine because they don't even know. To cap it all, I will mention that screening all pregnant women for hepatitis B vaccine, for hepatitis B virus, is very crucial, and we all must understand, because it reduces the global burden. It helps in achieving the target of the World Health Organization by 2030, that total eradication of hepatitis B virus, or drastic reduction to a very low level. And by screening all pregnant women, we can ensure that the generation of transmission is being controlled or cut, or is being, yes, controlled or cut off. Antivirals for high viral load mothers. You should remember, these are the key things that you should remember from this presentation. And newborns must receive timely vaccine and hepatitis B immunoglobulin injection. Just don't forget, in some instances, like in the UK, or if you are being managed by a UK trained doctor that have this protocol, if if you don't enter the brackets of indication for hepatitis B immunoglobulin, your child may not be given, and it will continue to follow up and be sure that your child remains safe. And After then, either the child got the hepatitis B immunoglobulin or not, there is still going to be follow-up testing to ensure the prevention has been successful. I want to say a very big thank you for staying tuned to this channel to the end of this presentation. I know you must have learned one or two things. I would like you to press the like button, the subscribe button, and you are free. It will be good for you to share knowledge because that is where it starts from. Share knowledge with people that don't understand. There are a lot of people out there that want to know what happened. Does that mean a pregnant woman that is diagnosed with hepatitis B is that the end for them? No. Share the knowledge with people. Let them understand. And till next time, stay informed.